Good
afternoon and welcome to today's Impact Stakeholder Committee meeting. We are pleased to join you today on the heels of releasing our Master Plan for Aging annual report and our 23-24 initiatives. My name is Amanda Lawrence. I am the project director for California's Master Plan for Aging, and I'd like to go over a few housekeeping items while we allow participants to join the line. On our next slide, you will see that we have public comments on our, we are meeting via Zoom today only and providing American Sign Language interpretation, as well as closed captioning that you can begin using by clicking the CC button in your toolbar. Today's slides, video recording, and transcripts will all be posted online to Cal HHS's MPA webpage. You can always find the recordings of our meetings on CDA's YouTube channel as well. We do have time set aside on the agenda for public comment this afternoon. We have 15 minutes reserved at the end of the meeting. On the next slide, shares instructions. If you are joining us by phone today for your audio, you can go ahead and hit *9 on your dial pad to join the line. Next slide, please. And if you're joining by Zoom, then you can go ahead and hit the raise hand button if you have a question. We do allow 2 minutes per participant to make your public comment, and we record all of your comments via for MPA input and stakeholder input and engagement. You can always email us at engage@aging.ca.gov if you have additional comments you'd like to share. I'm going to go ahead and hand it over to the California Department of Aging's Director, Susan DeMorris, for opening remarks, welcome, and the review of our agenda for today.
Thank you, Amanda, and good afternoon to everyone joining, especially to the members of the Impact Committee. Today, we start off our stakeholder season with your first official meeting of the year. We have a packed agenda with lots to discuss. We had really hoped today that we could continue with the momentum and enthusiasm that we all shared in celebration on Friday as we unveiled the Master Plan for Aging annual report and the new initiatives and our initiative tracker. But today is not that day. Today is a very sad, very, very sad and somber day in California. We are all just shocked, saddened, stunned, speechless, angry, and the list goes on of emotions and feelings that we all must be feeling today on the heels of the Monterey Park mass shooting and the Half Moon Bay mass shooting that followed. And I would like to invite us to take just a moment of silence to honor the 18 victims, all of those who witnessed these two tragedies firsthand, their families and friends and their communities and our entire state as we're grieving the loss of 18 senseless lives lost. So we'll just pause now for a moment of silence. Thank you. We can be very efficient on Zoom, and I really wish today we were all together as a community of older adults, people with disabilities, family caregivers. The Master Plan for Aging reflects the intersection of so many issues, and what we've just witnessed in the last 72 hours brings to bear all of the issues that we're working on and for and toward through our Master Plan for Aging. The intersection of age, gender, race, income, behavioral health. The list goes on. We've witnessed in the last 72 hours all of this unfold. And I just want to thank so much all the participants in the Master Plan for Aging process, the Impact Committee, our other stakeholder groups, all of you who developed our new round of initiatives. I hope you will see reflected some of these very issues that we're grappling with today that we anticipated as a community, because we know that our work is not finished. In fact, what we've learned Saturday and yesterday is in many ways, our work is just beginning, especially when it comes to behavioral health, mental health, the crisis and distress that so many people in our state are living in daily. So on that somber note, we'll show now the agenda that we have. We still do have much to celebrate, and it's reflective of the work that's been happening for many years in California by all of you on this call and people listening in. So we'll go ahead and just show the slide that shows what we're going to cover today. I guess we'll start with a listing of the Impact Stakeholder Committee members. I believe all of you are represented today. With one exception, I believe Doug Moore may have somebody representing him. So welcome Elizabeth Edgerly, Andy Imperato, Nancy McPherson, Sarita Mahantni, Doug Moore, who may be represented by Adrian today, Sharon Nevins, Kevin Prindeville, Kieran Savage Sangwan, and Fernando Torres Gill. These are the members of our Impact Committee, and we thank you for your service and for being with us today. We will start with an overview today of the governor's proposed 2023-2024 budget. We'll follow that by a little bit more detail on the annual report and the master plan initiatives for the coming 2 years. All of you, I hope, participated on Friday where we got a quick overview, but today we're going to go into a little bit more detail. We're thrilled to be joined by a new legislative leader midway through our meeting. We will welcome the chair of the Assembly Aging and Long-Term Care Committee, Dr. Baines. We'll spend a little bit of time walking through the MPA implementation tracker, and then we're going to leave time and space for stakeholder committee reflections, be it on the master plan for aging, the proposed budget, the events that have occurred over the past 72 hours, or other thoughts. And then we welcome public comment at the close of the meeting. So with that, it is my pleasure now to introduce to all of you, I don't think she needs to be introduced, but to welcome, I guess I would say, Kim McCoy-Wade, the Senior Advisor on Aging, Disability, and Alzheimer's in the Office of Governor Gavin Newsom. Kim, welcome, and thank you so much for joining us today for the Impact Committee meeting.
Thank you so much, Susan, and thank you so much for your words. It is a somber day, as the governor has said. He'll be making remarks at Half Moon Bay in a few minutes, but as he has said, tragedy upon tragedy. And I've had the privilege and the sorrow the last few days of amplifying all of your voices about the context for these particular shootings, with older adults as the victims, primary victims, older adults as the perpetrators, the particular significance of Lunar New Year and the loss of these elders in these communities where they are so revered. It is really a tragedy upon tragedy. It is a time both to lift up what is unique about this terrible event, and also what is all too common, whether it is behavioral health needs going unmet in a culturally and linguistically appropriate way, or the scourge of guns that don't care how old you are, that take all lives. So we have much to do. This community has not, unfortunately, has far too much experience with grieving, but also supporting each other to turn that grief into resolve and into action. So with that sentiment and spirit and commitment, I will do a very brief budget update. Jan 10 seems like a long time ago. And the good news is we've got many weeks and months to work together on a final budget with the legislature, with all of you, to get to where we need to be. But it is important. The budget is our annual statement of our values and our fiscal picture. And I want to give you a quick report on where that lies. So at the very top, this year is different than the last 2 years where the master plan has been in play. It is the tightest budget. So you, as you know, you did not see the huge and diverse and deep investments that we've seen the last 2 years. This year is much more about delivering on those previous 2 budgets, making sure those services and policy changes reach the Californians they're intended to, leave no one behind, and move us forward to an age and ability friendly state. But those of you who've been around aging and budget for many years, it also is not as bad as we have seen in the past. We are not, because of the reserves, because of the one-time investments, we are not looking at some of the terrible cuts and cliffs that we have seen in the past. So it's kind of that middle path to start this conversation in January. And I do think it is fair to say it is deeply grounded in values of protecting people and equity. Some of the priorities in this community, fighting poverty and homelessness with the restorations of the grants for the most basic needs for our poorest seniors and people with disabilities, SSI, SSP, protected. The expansion of healthcare to all older adults that began last summer, regardless of immigration status, protected. Historic and ongoing investments in home and community care, whether through CalAIM, community services, or enhanced care management, nursing home reform, protected. And of course, we continue to move on inclusion with the housing investments, the emergency investments, the transportation investments, all continuing to be all ages, all abilities. I don't want to minimize that there are timing changes that are real on the ground, and so we need to be in dialogue about that. There's things that end soon, like the home and community-based services spending plan. There's things where the timeline has been elongated, like the Older Americans Act money, and there's things that have a later start date, like the Food for All expansion to older adults, with regardless of immigration status. Let's stay in discussion about all of those things. The financial picture is changing. We need to hear from you. We need to hear from the legislature, but want to acknowledge those are not insignificant changes as well. And lastly, even in this tight fiscal time, there are some things that I think this community can be proud of and point to. First and foremost is the proposal on rental housing in Medicaid to provide that transitional rental support. We know rent is one of the top needs of older and disabled adults and all working people to thrive and to prevent this homelessness crisis we see all around. And two, there's major behavioral health investments, again, thanks to the leadership of Secretary Galley and First Partner, prioritizing behavioral health, hearing from you all that that too needs to be all ages and all abilities, and more to come on that. And then last but not least, continued investment in our developmental disability system, which, as we all heard at the last Alzheimer's meeting, now has a majority of adults in its system. As more people are living longer with IDD and maybe even outliving siblings and parents, there's a lot to do in the aging space. They're hiring their first aging person, and those rates, the rates for care at home in the community continue to be protected. And I am pleased to see the first ever autism services branch there too, as one of our fastest growing IDDs to bring into our community of aging and disability. So there's things to work on, things to protect, things to discuss with your expert help, and things to lift up. But this is just the beginning. I welcome all of you. I want to thank AARP California. I think you said it best. You will continue to advocate for the needs of older and disabled people and their families, and especially their desire and right to stay in their home and community of choice. So I look forward to all of that with all of you. And again, want to end where we began, just grateful to be with all of you as we navigate this tragedy and this challenge. I do want to single out the voices that I've heard so loudly and powerfully in the last 72 hours. Kieran Savage-Sagwan from California Pan-Ethnic Health Network and Rallying Resources for the Community, Denny Chen at Justice and Aging, your leadership on the Equity Committee and ongoing, and of course, LA County Agency on Aging, which Sharon Evans is representing the network here today. So I just want to thank, I know all of you are doing all you can, and of course, Director Damaris getting out resources to the entire cabinet work group and the entire state administration so we can all use our channels to stand with and for older adults and people with disabilities in all of California at this time. So that's the budget update. Again, the beginning, not the end. I will hand it back to Susan. And thank you so much for all that you're doing. Be well.
Thank you so much, Kim. And thanks as always for being just a terrific partner. And as we try to communicate in San Mateo County and LA County and statewide, for amplifying those messages and identifying trusted local spokespeople that can really help convey the important messaging that we're trying to get out about what is available to help support the community. So thank you. And thanks for being with us today. We really, really do appreciate it. Next on our agenda, I would like to turn it over to Sarah Steenhausen. Sarah is the Deputy Director at the California Department of Aging's Division of Policy, Research, and Equity. And Sarah is going to walk us all through the annual report and the new 95 2023-24 initiatives in a little bit more detail than we were able to spend on Friday's launch event. Welcome, Sarah, and thank you.
Great. Well, thank you so much, Susan. It's really wonderful to be here with all of you today. And I just wanted to reiterate what Susan said. I'm here to really share 3 milestones. One is a high-level overview of our second annual MPA progress report. 2, a high-level overview of our 2023-24 initiatives, of which there are 95 new initiatives. And then finally, just touching on the new MPA implementation tracker, which is a publicly available database to track MPA progress that Amanda Lawrence will walk through today. Next slide, please. So as you all know, last Friday, we released both the MPA annual report and our next round of initiatives. And I'm going to walk through each of those now. And then on the far right of the screen, you can see our implementation tracker, which really is a wonderful new tool that we have to provide you with updates and a searchable database of our progress on MPA implementation. But I first want to start with some of the high-level achievements of last year's implementation of the Master Plan for Aging. Next slide, please. So first, again, you can see all of this in detail in our MPA progress report, but I just wanted to highlight some of the main areas of progress across our 5 goal areas. Goal 1, housing for all ages and stages. We are really proud of the state and the legislature and the governor together for investing more than $20 billion in affordable housing. And the hope is that we will start to see the results as it plays out on older adults and people with disabilities to really fight not only our homelessness problem, but to ensure that people have access to affordable, accessible housing. Second, building capacity for housing and services while preventing homelessness. We're so proud of the work of our partners at the Department of Social Services, allocating over $100 million to fund 19 projects to create more residential care options for older adults and people with disabilities. Next slide, please. Goal 2, Health Reimagined. This is quite an encompassing goal that includes healthcare all the way to long-term services and supports, but really focusing on the needs of the person with a whole person approach to care. So we're really proud of expanding healthcare affordability and access, including expanding coverage for people who are 50 and older who are undocumented, eliminating the Medi-Cal asset test by 2024, eliminating the Medi-Cal working disabled premium. Second is investing in home and community-based services. We have some significant investments to restore the previous reductions that were made to the IHSS program, investing $60 million for adult day services COVID recovery, and a new community living fund that our partners at the Department of Rehabilitation are launching, which is focused on preventing institutionalization and assisting with transition to the community. This is a really significant program that can have a big impact on older adults and people with disabilities. And finally, certainly last but not least, investing in Alzheimer's care and support. Really proud of California for launching the nation's first dementia care aware program, which is assists in screening and detecting Alzheimer's for the older adult population. Next slide, please. Goal 3, inclusion and equity, not isolation. I mean, as we've discussed, equity is something that we really are focusing on incorporating throughout all of our master plan for aging initiatives. But there are some particular initiatives to really focus on in this goal area that has to do not only with embedding equity, but also ensuring that older adults and people with disabilities are included within and engaged in the community. So a few examples, in the area of volunteerism and intergenerational engagement, $10 million has been invested to expand the foster grandparent and senior companion programs. A lot of efforts to bridge the digital divide, including $6.5 billion invested in 2021 to expand broadband, which of course is really critical for older adults and people with disabilities who rely on access to technology to help them remain at home and in the community, while also maintaining a connection to the broader community. Our access to technology initiative at the Department of Aging, we're really pleased that it is being launched, and it includes $15 million that will be given to counties to support access to technology for older adults and people with disabilities. Our Aging and Disability Resource Connections program, we're really proud to be expanding our ADRCs as a real central hub for information and support for older adults and people with disabilities. We now have presence in 15 counties across the state, with 9 emerging. And we're really pleased that we're also advancing a statewide no wrong door system as a related effort, part of the kind of broader umbrella to ensure that people can access information wherever they are and however they need it. Finally, in terms of protecting older adults and people with disabilities from abuse and neglect, wonderful to see that the Adult Protective Services Program has now been expanded so that eligibility now is for individuals aged 60 and over. Next slide. In the area of Goal 4, caregiving that works, I think that the stakeholder community has done a tremendous job in just outlining that no matter what investments you make across the continuum of care, you really can't meet the goals of the MPA without a workforce. And we know that our state is confronting a significant challenge with our direct care workforce. So we have a number of important initiatives that are currently underway. The In-Home Supportive Services Career Pathway Program has been launching across the state. Our CalGrow's Direct Care Workforce Initiative is launching through the Department of Aging. We're really pleased to be awarding several new projects, over $80 million later this month. And we're also really pleased that these initiatives are really population focused, serving the direct care workforce that serves older adults, people with disabilities, people living with dementia and Alzheimer's, to ensure that we're not only addressing the workforce needs of our paid direct care workforce, but also our unpaid family and friend caregiver workforce that is providing the bulk of services to older adults and people with disabilities in their homes and the communities. Next slide, please. And finally, Goal 5, affording aging. We have so much work to do in this space, but really excited to see some of the advancements, particularly in ending older adult homelessness, the Housing and Disability Advocacy Program, with approximately $300 million invested into that program, as well as the Home Safe program with $185 million to ensure that people who are at risk of homelessness can stay in their homes and get connected to the services that they need. And finally, in the area of improving economic security, we're really pleased that we have SSI, SSP increases for individuals and couples that came through with this year's budget. Next slide. So I want to move forward now to the new initiatives, 95 new initiatives that have been developed across our 5 bold goals. Just stepping back a bit, I think it's really important to consider how these initiatives were developed. all of our master plan for aging stakeholder advisory committees have been critical to informing our understanding of the needs of this population and the priorities to address. So taking all the work of these committees that have been working over the past 2 years, of course, including impact, that culminated in the day of action last fall, where we had participation both virtually and in person from approximately 1,000 community members and state officials and consumers. Really, really pleased by the engagement of our stakeholders. And it was with those priorities that were presented that really helped inform where we started with launching our new initiatives. And so what we were able to do is take where we were building progress across our prior 132 initiatives and weave that into some new initiatives and some modified initiatives for a total of 95 new initiatives across the 5 bold goal areas. What's really important to note is it's not as if we've just dumped all the work from the last few years, but we're incorporating it moving forward. And as Amanda will cover in the next few minutes, the MPA progress tracker can help you see in real time where we are, both in terms of our prior initiatives from the last 2 years and the work that we're just starting to launch with our new initiatives, the 95 new initiatives. So next slide, please. I know that you all have access to the details in the 95 different initiatives across the 5 bold goals, but we really wanted to lift up a few of the initiatives that we feel respond directly to some of the highest priorities that our stakeholders have elevated over the past few years. First, in the area of housing, I think that the Impact Advisory Committee, as well as our Disability and Aging Community Living Advisory Council, has done a tremendous job in continuing to reiterate the importance of investing in housing, affordability and accessibility for older adults and people with disabilities. And in particular, the highest priority initiative to really look at our emerging local government models to inform the consideration of rental subsidy programs. We know that so many older adults and people with disabilities are renters. So with the rising cost of rent across the state, it's really challenging for many individuals to remain in their home. So we're going to be looking really closely at how some of our local level leaders are launching some rental subsidy programs to see what we can learn from that and to inform our thinking at the state level. Second is transportation. The Transportation Subcommittee of our Disability and Aging Community Living Advisory Council has done a tremendous job engaging stakeholders on the need for more integrated, accessible transportation models. There's a lot of work to do, a lot of opportunity, but we're really excited to continue moving forward with this, including how we might strengthen our consolidated transportation service agencies, and look forward to continuing to work on that. Third, we have heard loud and clear from so many of our stakeholders about the tremendous crisis facing people in terms of how they finance their LTSS services. This is something that has been a significant priority for the past few years. We've seen the launch of the Long-Term Care Insurance Task Force and their work to develop a feasibility study for a LTSS benefit. We also had a number of initiatives prior to that through the Department of Healthcare Services to do actuarial analyses. We're really looking forward to continuing to elevate options for developing a universal LTSS supports benefit, including a focused look on additional LTSS affordability and financing options through an initiative that we're launching here at the Department of Aging. Third is in the area of behavioral health. We know that I think the events in the past few days have just shown that often older adults are not seen. And in particular, we often forget that the tremendous unmet need for behavioral health services for older adults and people with disabilities, and the need for investment and replication of best practices. So we heard a lot, particularly from our partners at the California Commission on Aging, for the need to invest in this area. We're thrilled to be partnering with the Mental Health Services Oversight and Accountability Commission to expand access to evidence-based behavioral health programs. And we'll be launching an $18 million RFA to expand both the PEARLS project and AgeWise. So really excited about that. Fifth, in the area of Alzheimer's care and support, our Alzheimer's disease and related disorders advisory committee has continued the important work that was elevated by the governor's Alzheimer's task force, and really continuing to educate us on how we might best care and provide services for the population, not only of people with Alzheimer's, but for their caregivers. So we're really looking forward to replicating best practices that have been developed as part of California's Healthy Brain Initiative and Blue Zone efforts, along with a number of other related initiatives in this space. 6, no wrong door. This is often the catchphrase, and it's basically California's efforts to ensure that no matter where you are located throughout the state, if you're an older adult, a person with a disability, or a family caregiver, and you need access to information and supports, you shouldn't have to struggle with a very fragmented information service delivery system. So not only do we want to promote the state sustainability of our local network of aging and disability resource connections programs and grow them to statewide presence, but we also want to develop a larger infrastructure, a no wrong door infrastructure through a number of different initiatives, including a consumer-facing web portal, as well as a customer contact center, so that people have a way of accessing information wherever they are and when they need it in a standardized way across the state. And finally, and important, not last but not least, the area of caregiver support, supporting our state's over 6 million unpaid family caregivers and friends who provide the bulk of services and supports to older adults and people with disabilities in the home and the community. We have seen a lot of advancements at the federal level with the RAISE Family Caregiver Act, and we are very excited to have California lead the way with developing a statewide caregiver equity roadmap and strategy to ensure that our 6+ million population of family and friend caregivers are given the support that they need to care for their loved ones at home and in the community. Next slide, please. So now I'm pleased to turn it back to Susan DeMorris to introduce Dr. Jasmeet Bains of the Assembly. Thank you.
Thank you, Sarah, for that walkthrough. I don't know that Dr. Bains is with us just yet. Let's see if she has joined.
She has not. We are actually about 15 minutes ahead of schedule, so we have time for some Q&A related to Sarah's presentation.
I think that'd be great. So we'll go ahead and start with Impact Committee members. And you're not limited to the slide that Sarah just shared if you've had a chance to review the other initiatives. Any questions about the annual report or the new initiatives?
We do have thoughts and questions on the initiatives, but we had prepared to speak about them more in the section of the agenda reserved for our feedback.
Okay, great.
So I'll say that just to sort of free my colleagues here too, that if they want to start with some questions that aren't part of our presentation letter, go ahead and jump in.
Nancy, I see your hand raised.
Yes, I really appreciate what Impact is really focusing on today, which is long-term services and supports in homelessness. But I'm captured, Sarah, by Initiative 9 on transportation related to integration of accessible transportation models. Does this mean that there's going to be a really strong focus on human services transportation coordination with, getting rid of that spaghetti map of how all of these transportation options don't integrate, And where funding streams, it's difficult to actually combine those in some way. Could you say a little bit more about that?
Absolutely. Thank you, Nancy. You're absolutely right. There's a huge need to modernize this system and have it more integrated for older adults and people with disabilities. What's important to note is that we are in the analyze stage of this. So we're really thankful to have some resources from our Master Plan for Aging Foundation partners to do some detailed policy work in this space. And it's the hope that that policy platform can really help the state in understanding what needs to be done to do exactly what you're talking about. So the goal is to do what you have mentioned, but I think that we have to start with the hard work of figuring out how to do it and then figure out what's next.
Fernando,
Oh,
Dr.
thank you.
Torres-Gill.
Fernando here. Sarah, I was really intrigued and excited about the rental subsidy program. And of course, you know, we're all concerned, as you mentioned, about older adults, persons with disability winding up unhoused. Where is that? Has that started? Is that to begin? And how much did you say will be in that program?
Yeah, thank you for asking that, because I do want to clarify. The state has not developed a rental subsidy program for older adults and people with disabilities. However, what Kim McCoy-Wade pointed out is that CalAIM will provide some limited rental subsidies for people who need assistance to stay in their home. What this initiative is about is looking at some of our local partners who are really leading the way. San Diego, for one, as well as Santa Monica, we've seen, who are doing targeted rental subsidy programs for older adults to ensure that they can remain at home and avoid having to become homeless.
Mhm.
So we want to learn from that, and we want to think about what it would take at California's level to really advance it to the next step.
Thank you for that. And I'm going to suggest to our stakeholders, our impact committee, if we can discuss how we can advocate for something that's broader, because as we all know, it will cost a lot less to subsidize somebody's rent than to work with them and try to help them when they're already on the street. So anyways, it's something I would like us to broaden in terms of our advocacy.
Great, thank you.
Thank you. And Fernando mentioned advocacy. I wanted to note, thank you all. Nancy, I wanted to thank you for AARP's budget letter and for others that have weighed in on the governor's proposed budget and taken the time to comment after the master plan was released. We really do appreciate that organizational focus, and it's great to hear and share your feedback widely, with the governor's office and with the administration and the different cabinet agencies that we work with. If we don't have any other questions from impact committee members, there were two in the Q&A that we might have time to address before the assembly member joins us. I'm not seeing any others. So there was one question, if time, could you say more about the current new thinking about an LTSS benefit? So this could be 40 minutes, but Sarah, if you could just give a quick synopsis of where we sit today.
Well, I would say first, thank you. That's such an important and timely question. First, we want to recognize just the extent of the importance of this issue and of developing some sort of solution to address the needs of those individuals who don't yet qualify for Medi-Cal and yet can't afford their LTSS needs. I think the Impact Committee has been very vocal and clear in highlighting this as a really critical issue to address. So where we are with this right now is a couple of places. One, there's a long-term care insurance task force that just released a feasibility report on what are some options for developing a statewide LTSS benefit. What they're doing now is they are now having an actuarial analysis to determine what the financing of that would look like and what some of the potential funding streams could be. Additionally, the Department of Aging was given $4 million in last year's budget. $4 million in last year's budget to continue analyzing and exploring options for the development of a statewide LTSS benefit. There's a lot of considerations to factor, including how extensive this benefit will be, who is eligible for it, what the financing mechanisms are. And I think what our focus will be in the Department of Aging is really engaging stakeholders to pick off, kind of supplement the work that the the Long-Term Care Insurance Task Force is doing, and really to dig down and hear from stakeholders and consider some of our policy options so that California can lead the way in developing a solution to this critical issue that we're facing.
Thanks, Sarah. That was from Kristen with San Diego County. Her question disappeared, but thank you, Kristen, for that question. The next question is from Kelly Bond. Could anyone speak to your connection with Blue Zones? I work with Blue Zones project and would love to better understand the work being done in this area. I can answer that one. The California Department of Public Health has just entered a partnership agreement with Sacramento County, where they are bringing the Blue Zone project together with the Healthy Brain Initiative that's been underway in Sacramento County, and combining the two in one county to see what opportunities might exist for further replication outside of Sacramento County. So if you want to learn more, that's happening in Sacramento County. And still looking for the assembly member, and that was Kelly Bond. Next, we have a question from Gary Batchelor. Can you expand on support for caregivers and how employers are being educated on the caregiver needs of their employees?
Right. Well, I will take a few, in terms of how we support our caregivers. This is there's a multi-pronged approach. First, the Department of Aging is so pleased that we now are working and administering the Caregiver Resource Center program, which is a wonderful program in 11 centers throughout the state that provide services and supports to people who are caring for loved ones in the community. Second, CDA also has oversight of our services that are provided through our Area Agency on Aging Partners to support our family caregivers. We know that these two programs alone are very, very critical, and we want to figure out how we can expand access to these sorts of services and supports, and particularly looking at it with an equity lens to ensure that we are reaching the hardest to reach communities, and including the communities of color that oftentimes aren't accessing these services and support. So that's where this caregiver equity roadmap comes into play. And we really need to think about how we're going to expand our infrastructure in this space. On a related note, I just wanted to note that we are going to be, we are working with our colleagues at the Department of Healthcare Services to look at our broader infrastructure of our home and community-based service delivery system through our project called the Home and Community-Based Services Gap Analysis and Roadmap. The Department of Healthcare Services is focusing their analysis on the infrastructure of Medi-Cal home and community-based services. We are supplementing that with a focus on the non-Medi-Cal home and community-based services, including programs such as the Caregiver Resource Centers and others that serve family caregivers, to look at our statewide infrastructure broadly across our home and community-based service system, figure out where the gaps are, and then more importantly, to build a multi-year roadmap on how we actually build out the infrastructure for the service delivery system across Medi-Cal and non-Medi-Cal services. So while they are two separate projects, we are definitely working closely with DHCS on it and look forward to engaging stakeholders on that. So those are a few of the ways that we're looking to support our caregivers. I think finally, what I want to note is our direct care workforce initiative, California Grows, that I touched on. What's really exciting about this is that that initiative has recognized that direct care workforce also includes unpaid family and friend caregivers. So there are going to be we will hear of investments made to support the programs who are training and providing incentives to our unpaid family and friend caregiver workforce. So I think that's kind of our multi-pronged approach towards supporting caregivers. Susan, is there anything else that you would want to highlight?
I don't know that I heard that there was the expansion of the paid family leave. So in terms
Oh.
of the question with employers,
That's great.
we were so thrilled that the legislature and the governor together, and the first partner is a key leader on this too, that we've expanded paid family leave in the state of California. So that's another avenue for employers to support their employees.
Absolutely.
And we're watching for the assembly member ready to add her in at any point. But meanwhile, we'll just keep taking these questions if you don't mind. This one is from Elena Francisco. With more and more Americans retaining their teeth, is oral health care being considered in the LTSS and other areas of the MPA?
Thank you, Elena, for that question. Oral health is so critical. And while we don't have a specific initiative tied directly to oral health, I would definitely say this is an example of the fact that the MPA is a framework, setting the parameters of how we want to get to a state that is ready to provide for older adults and people with disabilities by the year 2030. That said, oral health is a critical component of our broader healthcare delivery system. So we would welcome stakeholder input on developing out, the issues and the recommendations that are needed to advance in those areas. And really highlighting that, I think, would welcome people to participate in our different stakeholder advisory committees to elevate those issues.
And we've got one more question. This could be just perfect. This question is from Steve Summers. Appreciate the high level overview. Could you say more about data analytic efforts to identify disparities in access to services and outcomes for racially, ethnically diverse older Californians, and programmatic efforts to reduce those disparities? For example, the caregiver roadmap.
Great.
Thank you,
Steve. Great to hear from you. I would say a number of things. You're hitting on a key point, which is the importance of data in understanding population needs, who's using services, who's not accessing services, where services are available, and what we might do to build them out. So I touched on the role of the home and community-based services gap analysis. That will definitely be a really critical component to looking at the data, not only of where programs are available, but who is using the services. The DHCS gap analysis and roadmap is also supplemented by their LTSS data dashboard, which is a phenomenal tool that will enable us to understand much more about this LTSS service delivery system in the Medi-Cal side and where we are accessing, where programs are and what we can learn from the population that is receiving those services. So we're trying to get a much bigger picture of not only where the programs and services are, but how people move through the system and where they might have gaps in their own service delivery system and where they might have duplication or inefficiencies in service delivery. So I think that, the work of our California Aging and Disability Research Partnership is doing a lot to try to advance our data dashboard for aging so that we can continue to get the data that we need to understand the services and the needs of this population. And also with an equity lens to look at underserved populations and where we might build out those other services. But also, what research do we need to do to better understand the needs of this population? Just one example, we're really pleased to be working with our Equity Advisory Committee on Aging and Disability, as well as our research partnership, to launch an LGBTQ study on the needs of California's older adults. We do not have a good data set in this space. We need to understand what the service needs are across that population, focusing in on communities of color, so that we can better target services to meet the needs of that population. So that's an example of how we're trying to develop more data. And then second, how we're actually trying to utilize the data that we have to understand the gaps and the needs.
Thank you, Sarah, and thank you for all the questions. I'm so glad we had time to take those. It's now my privilege to welcome and introduce to all of you the most recent legislative leader in the Assembly who will be carrying the baton for the aging and disability issues that we're working together on through the Master Plan for Aging. Her committee has not yet even met, and already she's participated in 2 stakeholder events and has been meeting, I know, with individuals and organizations up and down the state. We're so pleased to welcome Assemblymember Dr. Jasmeet Bains, who chairs the Assembly Committee on Aging and Long-Term Care. And we welcome you. Thank you so much for being on time and for joining us today. We look forward to hearing your perspectives in your new leadership role and how we can support you in the Assembly. Welcome.
Hi, can you guys hear me okay? Awesome.
Yes.
So very, very honored to be here. Thank you for that introduction. I am Dr. Bains, the new chair for the Assembly Committee on Aging and Long-Term Care. This is a very, very big honor for me, specifically as a physician, as a caregiver in the past myself for my grandmother. This is where I can bring my skill set as from being a primary care doctor, in addition to my experiences of being a primary caregiver and my experiences on the front lines of COVID-19. Super excited to get to work. We have a fantastic team on the Aging and Long-Term Care Committee. I've been going around meeting some of the key players, and I look forward to meeting, as many as I can in these upcoming months as well before we get our first meeting on the books. For me, being a physician, I think enhances the ability of a person having a different set of eyes on this committee. I think, I'm the first doctor that's been appointed in this position as well. And specifically in COVID-19, seeing all the impact of isolation on our communities, isolation in our seniors. It's a growing problem, but we need to make sure that we prioritize this. If we don't prioritize it and we let it get out of hand, I wonder what's going to happen for seniors across the state of California. Again, super honored to be in this space. The other thing is, making sure that we develop protocols that are culturally sensitive in addition to linguistically sensitive, to make sure that we take care of people from all their cultures, whether Asian, Hispanic, African American, all cultures have a different view lens of aging and what happens closer to end of life care. So how do we work together to help families take care of their loved ones, increase in-home support services for caregivers, in addition to making sure that people's answers are answered culturally and in a way where everybody feels comfortable taking care of their loved ones. In addition to making sure that we bring more resources to rural areas, like the one that I represent, Kern County is a very rural part of the state. And I've oftentimes have said, if you want to know what will impact the state 5 years from now, look at Kern County. Look at what we see, because it's in real time of what the state will see in 5 years. This is where I hope to bring a lot of lenses and focuses on data and collecting some information specifically from Kern County so we know what we can do to impact healthcare and overall care for our seniors in the state of California. Again, I greatly respect the process and the master plan that has been set up, and I look forward to working and meeting all of you. The master plan highlights the intersectionality of aging and disability services, which is something I'm also very interested in bringing to the table, making sure our aging population with disabilities are also properly taken care of. And as a chair, I must insist that all legislation reflects what the impact to older Californians. So super glad and honored to be here. Thank you so much for allowing me to talk, and I look forward to working with everyone.
Thank you, Dr. Baines. Thanks for making time today to join us and to make your face and your words familiar to this group. The 100 or so participants on today and the 9 members of our Impact Committee. I know you've met with many of them already. See lots of this group in the weeks, months, and years ahead. So congratulations on being named chair, and we all look forward to working with you. Thanks for joining us. Appreciate it. Our next item is Amanda Lawrence will be demonstrating for all of us how you can use the MPA implementation tracker from the convenience of your own laptop or desktop. Take it away, Amanda.
Sure, it's finally here. I know we've talked about this at quite a few meetings. We want the MPA to offer transparency related to our progress that we're making over these 10 years. And with the magnitude, the number of initiatives we have, we'd like to make it easy for everyone to just find the information that they're most interested in, whether it be one specific goal or one specific department or agency or a topic. So I hope that you've had a chance to visit the tracker by now. We released it on Friday. I really cannot thank West Health Institute enough for their partnership on this and on our data dashboard for aging, which is another way that we are ensuring accountability to what we set out to do with this master plan for aging. They've been so critical in helping us with our data needs as we build out our own data and research shop at CDA. Next slide, please. So if you have visited it, and the link is in the chat for folks who haven't, when you log on, you can see where I have these red arrows on the left of the screen, the various search bars and filters. So you could go ahead and search by any topic or enter in a number. If you're interested in just one specific initiative, you could enter in the number of that initiative. You could also filter by the goal areas. So you could enter in 1 to 5 of the goal areas. You could also search by agency or department. We've actually changed this up so that it's not acronyms, but the names of the agencies and departments are spelled out. You could also filter by tag. When we input the initiatives into our tracker, we tagged everything with what their topic is. So caregiving, homelessness, housing, various tags exist that you could search by. We also have allowed you to search just by reports that include legislation or reports that include budget investments. We've also added a feature where you can just search for initiatives that do have recent updates. We have the 23-24 initiatives listed in the tracker. Of course, there are no updates yet for those. So that's why you would use that feature. You'd go ahead and click only include initiatives or reports with updates. I don't know if anyone on the committee has had a chance to check it out yet. Love to hear your feedback. We are, of course, this is an iterative process. We're still improving the tracker. I am still uploading initiatives for our updates from various partners who are still sending me their 2022 updates. The plan to keep this as updated as possible is to go ahead and I will remind our state partners every 6 months to upload any updates they might have, but they can update their initiatives at any time. So you could see some quarterly updates pop in here as well, but our goal is really to make sure that we have as comprehensive as a report available to everyone every 6 months related to our now over 200 MPA initiatives. I can go ahead and screen share and walk people through the tracker if you'd like, or take any questions anyone has about the new tool that we have created. Seeing Andy.
Yeah, hi, Andy Imperato with Disability Rights California, a member of the committee. One of the things that we've talked about as a committee is there are so many initiatives, sometimes it's hard to keep them all in your head. And I'm just wondering if you all are thinking about kind of the big rocks or the things that are kind of game changing, maybe things that have happened in the first couple of years and things that we're setting out to do over the next 2 years that really you think deserve focus and attention and might capture the imagination of stakeholders across the state. It's hard to track so many things, and I'm wondering if you've got a prioritized list of things that you think would create transformational change or be kind of generational change for California.
Yeah, we did use our annual report to do just that. We decided that we would really highlight those bigger ticket and more transformative items in our annual reporting, and then allow everyone to have this tool for the broader, really granular level interests that they may have. And I think that's great input for how we can, really communicate in the future and build out communication strategy related to what we want to share, to really create that systems level change. And we're also thinking about it from that position of, we know that California is seen as a leader on these issues of equity and of aging and disability, and how we would want to communicate those more transformative items that Sarah just went over to the broader national audience.
I might just add to that too is through the California Aging and Disability Research Partnership, we are in the early stages of identifying what were once referred to as beacons, but will be those 2 or 3, maybe as many as 5 key outcomes that we'll track longitudinally, that will be beyond the aging data dashboard. So with 2 years under our belt, we're not there yet, Andy, but that's absolutely where we're headed. Looks like Elizabeth has a question for me.
Yes. Hi, Elizabeth Edgerly with the Alzheimer's Association. It's not really a question, it's a comment. I want to just say how impressive the tracker is. Amanda, I've only been able to play around with it a little bit and see what's in there, but it's so well organized. And I want to commend Susan and the California Department on Aging for such an investment in communication about how are we doing with things. I know this must have taken a huge amount of time and effort to do this, and I'll have more feedback, no doubt, when I use it more, but I was just really impressed at what you came up with. So thank you.
Thanks, Elizabeth. Sarita.
Yeah, this is Sarita. I'm from the SCAD Foundation, and I want to echo what Elizabeth said. It is, you've, I think, really made an amazing effort to make this user friendly and as simple as possible. I'm sure it went through a number of iterations. I was curious, and I'm sorry if you said this, Amanda, but how you're tracking, like who's using the tracker, essentially, like what constituents over time. I mean, obviously this is a communication tool. It's an opportunity for people to see what is happening, what is budgeted, what is, all of those things. And I was curious, how, even since you've launched the tracker, what kind of uptake you're getting with people, and what kind of stakeholders are utilizing the tracker.
Yeah, those are great questions that we love the answer to. We do use Google Analytics for both this and the data dashboard for aging. So that gives us an idea of, how long people spend on the site, how many visits we get. It doesn't allow us to know exactly who is visiting each of these tools. And I'm not quite sure how to track that, but it's something that I can bring to our teams to find out if we can identify some way, whether it be a survey or we can track, really we can just sort of track how they find the tools and how long they stay there. Thank you.
Okay, so is that Amanda? Thank you. And I wanted, for those who, and many of you have been part of the master plan process and project from the beginning, and I'm thinking of 3 taglines that we have. One is it's a whole of government approach. And when you use the implementation tracker, you can see, which departments and agencies are working on these initiatives. We also are so proud that this is a public-private partnership, and we absolutely could not have done this. We could not have done it as quickly without West Health. So thank you again for our foundation partner that made this possible. And we also often say this is a report that was never meant to sit on a shelf. And this is something we really hope with the tracker, that you're not just waiting for annual reports to come out to leaf through the pages, but that it's dynamic, and in real time, you can get the answers that you need for your own organization, for your advocacy, for your boards of directors, whatever your boards of supervisors, whoever the audience is. This information is now at your fingertips to access and use as you wish, as is the aging data dashboard. So we're very excited about this, and we use it too. So we might be the ones that really make it look like a lot of people are using it, but it's a great internal tool as well. So we're now at the point in the agenda where we wanted to open the conversation up to our stakeholder committee reflections. And this is an open-ended, just if we were together around a table, we would hope this would be more conversational, but we really want to hear from impact committee members about top of mind issues and topics. And I invite any and all of you to share. We've got about 30 minutes set aside for this. Let me just confirm that. Yeah, we've got until 2:40. So I don't know if you have queued up, or we want to just do show of hands.
Yeah, thank you, Susan. We do actually have a few people queued up. So first of all, we want to say thank you to you and your team for all these wonderful materials. We really appreciate the clear, hard work that went into this. So we really thank you. I wanted to start with some comments on the budget and then move to some comments about the NPA initiatives. And just at a real high overview, I think you've heard from a lot of our groups, we're thankful that the budget that the governor put out as a proposed budget in January, even in a tight budget environment, had no cuts to programs that older adults and people with disabilities rely on. As I think was alluded to, there were some changes in timelines of certain things, but we appreciate the effort to ensure that things that were happening now and that people rely on today weren't cut back or removed. And that there's clearly a desire to continue investments in many of the areas where investments really ramped up during the last couple of budget years. So we really appreciate that. And we think that there's still opportunities for continued investment and a need for continued investments that will help ensure that even if the economy is shifting in a negative way, that communities will still be supported and won't feel the full effects of that shift. So you'll continue to hear from our community about ways and needs to make investments even in a tight budget year. On the NPA initiatives, like I said, thank you. You've shared a lot of information on Friday, really nicely done today, highlighting that information. We're continuing to dig into the information, but I'd say so far overall, we're pleased with the new set of initiatives. We see that they reflect a lot of feedback from the community through the September event, the Day of Action that we participated in. We can see a lot of the things we've been working on reflected back, and we appreciate that. We also think there's been an improved organization and structure. Andy talked about the challenge of so many initiatives, and we are making progress to narrowing some, and we're going to talk a little bit more about that as we go, about additional ideas for how to highlight the things that are the biggest issues to be moving on. And then we appreciate new things like the tracker is super helpful. So thank you for that. Today we are going to share, some more specific feedback. Some of it's going to be high level, some of it's going to be on specific initiatives. We're structuring our feedback in two ways. So Sarita is going to start us off with feedback around kind of process structure, how we're thinking about the work, how you're thinking about the work. And then after that, I'm going to share some ideas on substance of areas we'd like to see even more focus on and specific initiatives that we have questions about. And then throughout, we'll likely have some popcorn of a variety of committee members chiming in with ideas and thoughts and questions. So I'll pass it to Sarita to get us started on kind of overview of feedback on process and structure.
Great, thank you, Kevin, and thanks again to Susan and the team for all this excellent work. I mean, I'll, you know, as Kevin said, a lot of what, you know, we're just very impressed by, you know, the progress that has made. And I think one of the things I'm just going to highlight, and then I'll certainly open it up also to the impact committee members as well, is some of kind of our initial process, you know, reactions to the process, kind of our, you know, we collectively got, you know, we got together and had some impressions on the process itself and questions we had about the materials, et cetera. So we'll delve a little bit, I'll spend a little bit of time on that. I think, you know, one of the things, just kind of feedback that, you know, when we look at your kind of timeline, or when you track, you know, deliver, analyze, communicate, I think, you know, the question that comes up, you know, was that how do we know when we analyze things that they actually get to the, you know, into the deliver, the action, right? Like, and how is that being, you know, really captured, articulated? You know, is, you know, so it's versus, you know, like, so having a little bit more of that roadmap and, you know, would be very, very helpful to see. And I don't know if, you know, Sarah or Amanda or Susan want to comment now, or I can, you know, can go through the list, but that was one, you know, piece that I think we were trying to ascertain a little bit more as we were looking at the materials and the tracker itself. So I can stop there.
How about if you go through all of them?
Yeah.
I want to make sure we hear all of your
Yeah,
thoughts.
absolutely.
And we can always follow up later, but we'll try to answer.
Absolutely. Okay, great. Well, so that was one, I think, one kind of overarching. And then there were some other questions. One that we you know, you're probably aware of, and we wanted to highlight kind of what happened to the year 1 and 2 initiatives that were not completed and are not in year 3 or 4. So I can give some examples of things I saw and maybe just some questions. Like, for example, goal 2, the health reimagined, I think it's initiative 34, which is about the planning and developing innovative models to increase access to long-term services supports for people receiving Medicare only. And I know this was we're recognizing this, that this was included in the stakeholder recommendations and in September, and is one of the reasons why the Office of Medicare Innovation was created. So what happens to this initiative as it's not included in the 23-24 specifically? I wonder, or we wonder, you know, whether that's because it will take longer than 2 years. Maybe that's why it was kind of not placed in that 23-24. So that was another kind of comment, feedback question for the department and the team. The second one, I think, is initiative 44 under goal 2, which is the health reimagined, and this is around the high cap modernization, which is about modernization of Medicare counseling services to serve more beneficiaries. We know this work is being done, but it wasn't included in the initiatives for 23-24. So just wanted to flag that and ask about that. So these are examples of some of those, the ones that about what happened to the ones that were listed in year 1, 2 that are no longer being shown in year 3, year 4. Another question is what does it mean for an initiative to be active, but when there's no update? You know, is that, you know, kind of talking a little bit more about, you know, if it's active, you know, should there automatically be an update? And if it's not there, what does that really signify? What does it mean for an initiative to be complete? You know, so complete could be, obviously there's an end goal, but is it complete from a standpoint of a project? Does it tie to a 5-year vision, to a 10-year vision of the master plan being a 10-year blueprint? So really kind of understanding, kind of, again, I go back to a roadmap view as we're looking at these initiatives, how do they intersect, but how do they also tie into the long-term game? And And I think, I think those were some of the things that were kind of general reactions and some examples that I've offered. I'll actually pause for a second and actually see if the other members of the Impact Committee have other examples or want to delve in deeper to some of the comments I've made. So I'll pause there. Thank you. Any other comments from the Impact Committee on this?
I'll just add on this, we've been talking about the new thing you added of the deliver, analyze, communicate markers on each initiative. And we really like that. And we're really focused as an Impact Committee on let's put more green behind this plan. Let's deliver more. Let's be able to explain to the community how this is impacting real people's lives. We realize that needs some analysis, some communication. Those are important parts of that. But I think we're really interested in how any orange item, any analyze item, what is the path? What's the plan for turning that into delivery? So we don't want to continue to just analyze things and research things, but we want to know then what, or so what, as one of our colleagues has said, so that we bring that to changing people's lives.
Great. So we can give some sort of, superficial answers. Maybe some might be more involved that we can follow up with. I'll start with the first, and thanks for that feedback, Kevin, on the deliver, analyze, and communicate. So in terms of, I would want to make sure expectations are clear that sometimes analyze may not result in a deliverable because we may determine that something is not feasible or viable. There might be another path. So that's part of the analyze. In simplifying things, it could be assessing, it could be collaborating, it could be all internal, it could be public-private. So I hear you. The goal is absolutely, if the analysis is a feasibility study or a report with a consultant, or that we want to deliver on that report, but the report might not yield a deliverable to a person. I don't think that's helpful. And then in communicating, part of it is, letting all of know, but it just keeps widening. So getting messages out to the general public, communicating internally across, within agencies and across agencies. And then delivering doesn't always mean it's complete. The best delivery would be something that's ongoing. For instance, providing, full scope Medi-Cal coverage to individuals who are undocumented 50 and above. That's delivering, but it's also analyzing to get the numbers of the uptake and who's being served and accessing, but then also communicating that that's available and that people are eligible now for something that they weren't eligible for. So we may have oversimplified and things might not fit squarely. It was hard to fit everything into one of those three terms, but we hear you loud and clear that the end goal is for all of this to reach real Californians who need services and supports in some way or another. And we would hope that a lot of the analytical work that's happening in this 2-year phase will translate to deliverables. That shift might even happen in this 2 years, this 2-year period. And some will move quickly, some require staffing, hiring people or contracting with consultants, and some move quickly. So they're not all at the same, in terms of plotting on a timeline. They will move at different stages depending on the nature of the work. Sarah's going to touch on, what happened to year 1 and year 2.
Yes, great. And I would say, Sarita, it was such an important question about how we ensure and move from analyze to deliver. And I think that all of you as stakeholders have such an important role to play in that, because as we analyze and develop the communications needed to educate the community, our stakeholders play a critical role in building momentum and support too. So part of that is holding us accountable, but also what I love about the MPA is that it's a framework, but as Susan said, it's also iterative. So it is a live plan that we will use our analysis for to inform our future efforts, which might look different than we anticipate, but the expectation is action and delivery in some way. So in response to your great question about the launching innovations in the Medicare space, we're so proud and pleased to be working closely with our partners at the DHCS Office of Medicare Innovation and Integration, which, as you know, is being led by Anastasia Dodson and her team. What's really exciting is that they actually have built out, I would say this is a great example of an initiative that from the last 2 years that was built out into a series of new initiatives here. So you can see it in initiatives 28 through 30. There are specific references to the role of Medicare in improving healthcare affordability and reducing delays in coverage through both the Medicare and Medi-Cal changes to be implemented under the federal regulations tied to the Consolidations Appropriations Act of 2021. But also in Initiative 29, advancing our statewide goals to better integrate, coordinate, and align services across Medicare and Medi-Cal for our dual eligible population. And Initiative 30, I think, speaks a lot to what you were talking about launching the innovations. So this is where DHCS has been convening the Medicare Advantage plans in partnership with the Centers for Medicare and Medicaid Services, as well as support of our foundation partners, to explore strategies and common goals to improve quality, access, affordability, and equity for Medicare beneficiaries in the state. So I would say that their work is just getting started, and that happy to schedule any follow-ups to explore further that work. But I think that this public-private partnership and these tables that have been set with the Medicare Advantage plans will be critical to really acting on and delivering on some of these innovative strategies. So the work continues, I guess, is the best way to put it. So I know there was a question too that Sarita had about HICAP, Susan. I didn't know if we wanted to.
That might be, well, that was one of what happened to something. And it also kind of goes, the next question was, what does it mean if something's deemed active, but there is no update?
Mm-hmm. Mm-hmm.
Want me to take that one? Okay.
Yeah. Why don't you start off and then I'll add on to it.
Okay. So in the case of HICAP, for example, the Health Insurance Counseling and Advocacy Program, the deliverable was doing an analysis with a consultant, and those recommendations have now been delivered and they're being evaluated for action. So that's sort of the level set too, is sometimes we'll pick up the recommendations in total with all of the analysis that's happening. Sometimes we might do several of them and not all of them, or the work might be spread out over a few years' time. So that the HICAP one is probably fell between the two, where the recommendations were delivered and we've not yet determined what the next course of action is in terms of lifting those recommendations. Would you want to add to that, Sarah?
No, I think that's a perfect example of where it was kind of we had the project completed, but the work itself is not completed. So we are committed to continuing to work with our HICAP partners and modernizing that program. And, we'll be hopefully soon be able to give a little more detail and specifics as to what that looks like.
I hope too you saw more specificity in the language. So you might see some things from the prior year that were more aspirational. And parts of it moved into a more concrete recommendation this year is something we tried to do. We also heard, and we heard it today from Andy, it's hard to keep track of everything. We did try intentionally to reduce the number of initiatives, and we acknowledge not everything is reflected as an initiative. So there is work still happening that's not reflected here, and there is work that will come to us that's not reflected here. And we fully expect, with our partnership with the legislature, there will be bills introduced that will generate work next year if signed by the governor, that won't be reflected here.
Susan, are you thinking that at some point, I know that it's easier said than done, but as you're hearing, all these moving pieces essentially are happening in new initiatives or budget items, that will all be included in the tracker? Or are you like, just for people to understand where things are at, or even the high cap example, to know that, okay, there was work that was done, a consultant came in, that there are some core recommendations, and it's kind of now in the penned mode of, like you said, evaluation. So I was curious how you're envisioning, because there is, but also we would love to see connecting the dots of all these different work and how it's progressing, even though it may not be reflected right now.
And that's something we'll probably have to take back and look at. If it's not, it won't be on the tracker, is my understanding. So we will look at how we capture that work that's more ongoing.
And yeah, I also think, Sarita, to your point, we can be very careful in our updates on the initiative tracker to be as thorough as possible in helping connect those dots. So instead of just saying project was completed, we can actually give a little more of the specifics, in that kind of thing. And then always happy to follow up and have additional discussions on specific items and initiatives.
I think Elizabeth had her hand up, and Nancy is also showing her hand.
Yeah, and then we should move on to some substance too. So Elizabeth.
Okay, great.
Yeah.
You got it. Elizabeth, then Nancy.
Yeah, what I wondered is, and this relates, Sarah, both to what you were saying and Susan, and this whole conversation about high cap too, are there places where you think you'd be able to document the anticipated number of lives impacted? Like, Susan, it really struck me when you were talking about benefits for undocumented immigrants and all that. And I know you have some numbers in mind. And I guess my point is, where possible, because I know it's very hard sometimes to actually figure out what the number is, but sometimes you have a sense of how many lives are going to be made better as a result of that. If you have it, I may have missed it, but that I think gets at what some of us were talking about, and what was the impact of what you did on the lives of people living in rural communities who are diverse, whatever it is, just guesstimate. Do you think that's a possibility? And again, Sarah, it maybe gets to the detail of what happened, and then how many people you intended that to impact by what you did. That's just a thought.
We've made some progress on aggregate numbers. We're asking for specificity. Even, at our department, that's a challenge. It's not always easy to produce, and sometimes it's hard to break it down by geography. And if you look, for example, Older Americans Act or older, those numbers might be reported 18 months out after audits, and sometimes they're not in real time. But that's absolutely an end goal, Elizabeth, and something we hope to move towards. Hearing Kevin wanting to move to the substance, let's hear from Nancy, and then we'll be sure we have at least good 10 minutes for that part.
Thank you, Susan. I will yield to the gentleman from Justice and Aging.
Well, thank you, Nancy. Hopefully you get a chance to raise your idea at the end here. So we did want to transition some to talking about some of the substance of the initiatives and things that we've noticed so far. As you were just talking about, we appreciate that there's been a narrowing to some degree And we're going to speak about even a further narrowing, recognizing that there's many important initiatives, but we're not going to try to touch on all of them now. Last April, the Impact Committee did a report on the first year of MPA implementation. And in that report, we identified some big themes that we wanted to see further action on. And those themes were long-term services and supports and providing a system and affordability for people to get more care at home. The other thing we emphasized was homelessness and needing to address homelessness for older adults and people with disabilities. And then within both of those topics, really important equity issues to prioritize, and then the importance of building workforce to solve those problems. And increasingly as an impact committee, we're talking about just the connection between all of those things, that LTSS is an issue that relates to homelessness. That you have many people that are homeless that need a more robust, equitable LTSS system to address the homelessness. You have home care workers that are homeless because their wages are so low that they're homeless while providing care for someone in their home. So these issues are very much connected and related to each other. So we were looking at the initiatives first, just through the lens of those programs in particular. And so I'm going to start by talking about LTSS issues. You know, we are becoming more and more convinced that the big item in LTSS that we should be working on as we think about the scope and breadth and length of this master plan is we need to create universal access to LTSS. That means creating financing systems so that all people in California can afford LTSS, especially those now who don't have access at all. They're not wealthy enough to pay for care themselves, and they're not qualifying for the programs that we have today. So we need to build a system that people can afford care, and then there needs to be a system there for them to access. So we see lots of initiatives that relate to this, which we're pleased by, and we see that they're spread out throughout the whole MPA. There's something kind of in each goal area, which we think is appropriate because this is really something that's touching every part of people's lives. So we like Initiative 18 on that we've talked about already about evaluating options for universal access to LTSS and financing models. Initiative 81 on LTSS gap analysis. Initiative 57 around assessing LGBTQ older adults LTSS needs. 20 on implementing the HCBS settings rule. 19 the HCBS gap analysis. 23 and 24 around expanding and advancing some of the current programs that we have today. So we like all that. And in the theme of, you know, orange to green, we're looking for more specific action, more firm commitments that'll get us to delivery. So specifically on Initiative 18, there's been a lot of analysis the next couple of years. We know that there's more analysis that needs to happen about LTSS financing. And we're really looking for CDA and HHS and the governor to commit to solving this problem and taking advantage of the opportunity in front of us. A commitment to working together to find a path to financing universal LTSS. That's a huge priority for us. Steps to getting there, you know, Initiative 19, the gap analysis and looking at the money that the legislature gave last year to do some further analysis. We want to be really involved in that. We want to really be connected. We want to make sure that's all heading in a aligned direction so that we can get where we need to be. We also want to see more of the focus on equity issues within all of this work. And it's mentioned there, but we want to really collaborate with you on this. And we really like I said, Initiative 57, which calls out analysis of the specific needs of the LGBTQ older adults and the intersectional importance of that. And we want to see that similar deep dive in other communities where we know there's inequitable access today. So we'd love to see that called out and done for other communities, a disability community, looking at the aging and disability communities needs distinctly to understand the differences that are there, Latino community, Black community, rural communities, and especially immigrant communities and rural communities. So there's lots of different emphasis that can be modeled on that Initiative 57. And then there's some of these, another theme is, you know, turning analysis into delivered benefits. So initiatives like 23 and 24, which are about advancing the community care transitions program and the community living fund, and expanding access to certain programs. How do we do that when there wasn't a corresponding item in the governor's January budget? So, what's the path? How can we get some alignment between these goals and the Department of Finance and the budgets that are being put out? So we'd love to help you find dedicated funding to make those initiatives real, not just from kind of a analysis perspective, but as a let's open up more slots, let's get more people served, let's get more services out into homes and communities. And then finally, we're also excited about Initiative 70, which is a web portal to access information and connect people with programs. We know that's been missing, right? Any of us who've tried to navigate the system ourselves or supported a family member or clients, where to go to get information. So we're really excited about that. And we know right now you could give people all the information in the world, but we'd be giving them often information about programs that aren't actually available to them because they can't afford it or there's not capacity in the system to serve them. So let's be sure that we're not just building a portal to nowhere, but that we're building a portal to a real system. So that's all in the bucket of LTSS. Like I said, another big priority for us has been homelessness. And we appreciate that there's a continued focus in these initiatives on homelessness. And some similar themes as before, like we need even more specificity. So like Initiative 87 talks about the statewide action plan on preventing and ending homelessness and local homelessness plans, including data collection and annual reporting on older adults and people with disabilities. We're looking for more than that. We're talking about there's so much funding coming out for homelessness. Can we make sure that a certain amount of it is tailored towards older adults and people with disabilities that are, a huge growing part of the homeless population? So how can we really implement specific programs? One of the ones that we're most excited about is Initiative 1, I think it is, on the rental subsidy. I think Sarah highlighted that in her review. Actually, Initiative 2. This is another place where we appreciate what you can do right now is analysis. And there was a bill last year that was put forward that was a bill to actually create a rental subsidy program. And we want to encourage action on that. We think that we know enough to make this real, and we need the political will to do so. So we'd like to move forward on that. An area that we have concern is around, and it relates to homelessness, is around the SSP grants. So I think this is one of the initiatives in affording aging. I forget the number right now. And right now the initiative says that there is a grant increase that happened effective in 2023 for folks that receive SSI. We were part of making that happen. We're really excited to see that happen. But the language prior in years 1 and 2 was more aspirational. It was in that category you were mentioning, Susan. It was more aspirational. It said that we'd be working over time to increase those grant levels all the way up to the federal poverty level, or even ideally the elder index. So we have a question there about whether that initiative reframed as something that's already completed, because it took effect on January 1st this year. We don't want to lose the aspiration that there's more work to do on that initiative. We need to continue to increase those grants because they haven't yet reached the levels for inflation adjusted, the levels where they were back in 2008. Let's see, what else? Quickly here, because I know we're running out of time. On equity, again, we like the continued focus on equity. We like that there's really some specific equity items in the equity section, but also all throughout. It looks like all the analysis that's happening is with a focus on equity. So we appreciate that. And we'd like to see even more initiatives that are tailored to specific communities, like I mentioned before. And then finally, in workforce, this is an area where we do have some concern that the budget might have been taking a step back on some of the planned workforce investments, and that also because of the ending of the HCBS spending plan, we need to have a strategy for how the investments that have been made are going to continue so that they don't turn into one-time investments that didn't spur structural and systemic change. But we do appreciate that workforce continues to be spread out through this plan, and with a clear emphasis on equity, both with, you know, how the workforce is serving particular communities, and then how we're thinking about the workforce itself as a community that is diverse and has suffered a lot of inequities, and that we need to build new systems that create jobs that are equitable in order for them to be sustainable. So that was a lot. Sorry to power through, but I'll give my colleagues a chance to add anything else.
Thank you. I'm so impressed with, you know, what are we, 4 days after they were released, that you could bring us that feedback. And I know we're just starting, so I'm sorry you feel rushed, but this is the beginning of the conversation on the initiatives. We'll hear from Andy and Nancy, and then we will go to public comment.
Thanks, Susan. This is Andy with Disability Rights California. I guess I wanted to just go back to something I heard Secretary Galley say during the pandemic, which was, we may not get it right the first time, but we want to be the state that learns the fastest. And I'm wondering if there's a way to incorporate that as you think about year 3 and 4. You know, to me, the master plan is a compass, but we don't know what's going to happen in our state over 10 years that may require us to adjust and learn and do things differently, innovate. So, you know, we just went through the flooding. There's a lot of layoffs going on in the economic downturn. So I think just having a category where you're thinking about what's happening in the environment, what's happening to these populations that we're focused on in the master plan, and what are we learning from the interventions that we're trying that will better prepare us for the next time this happens. So I just put that out there as a category to think about.
Nancy McPherson from AARP. My points are more operational. The first one has to do with really appreciating the commitment to the long-term care universal social insurance programming, understanding the need for additional research on financial models, the actuarial studies, the gap analysis that we heard about. But any part of a significant campaign involves outreach and education for constituents and community members. And that could take a year or longer to be engaged in a campaign like that. That would be something that the state could begin to develop and build on while they're waiting for the answers to the research questions that have been posed. And I would just ask that some consideration be given to that. We're thinking of that in our own organization. You know, how do we build community taxpayer support for programs like this? And then what are we doing to educate elected officials and build political will for that? So that's my first point. My second is building on something that I heard Fernando say, and that is, yes, some of the counties are working on things like shallow rent subsidies to prevent homelessness. Is there a role for the state in convening those local officials, hearing from them firsthand what they're doing, asking them for what support they need from the state, and then us building a legislative agenda, whatever we need to do to support that larger funding mechanism that Fernando was talking about, that local jurisdictions don't necessarily have to drive change in that area. Thank you.
Thank you, Andy and Nancy. We heard you. We're going now to we want to make sure we have at least 10 minutes for public comment. So we're going to now switch to opening up the meeting to the public, and I believe Megan, is Megan gonna?
I'm here. Yeah.
There you are.
Hi,
Great.
everybody.
Thank you.
You're very welcome. At the moment, I don't see any hands raised. So just to remind everyone, you can raise your hand if you're joining us on Zoom. If you're joining us by phone, you can press *9 on your dial pad to join the queue in the waiting line. And we do have, we're asking for 2 minutes for public comment, please, just to give everybody a chance to speak and to stick to the timeline of everybody here. And we do have a hand raised by Connie Arnold at the moment. So I will go ahead and unmute, and Connie, just press your unmute button again yourself and you'll be able to speak for 2 minutes.
Okay, can you hear me?
Yes.
Okay, this is Connie Arnold. I was already on the HCBS gaps analysis and roadmap. And as a person living with a severe disability and being technically under the federal definition of having a developmental disability, I'm very concerned with this crisis we have now. We're talking about a Katrina crisis in care in California for those recipients with disabilities who cannot find care providers. And that includes whether you're on IHSS or whether you're not on IHSS and your income and your family income is too high to provide you access to long-term care services, just like you're talking about. Because I had a call yesterday from a family member of a quadriplegic that's husband is going back to work after family leave, and they can't really find any caregivers to provide competent care to the wife. And so they're asking me where to find competent care because it just isn't out there. And so you are forgetting that what needs to happen is 3 critical things. That is, there has to be an increase in provider wages to $20 an hour, like Congressman John Garamendi asked. There has to be differential pay for people with severe impairments, which pretty much includes quadriplegics, functional quadriplegics, and recipients with complex chronic care needs. And the other thing is this permanent backup provider services system is not working in California. I've been denied care twice now when I really needed it. I'm having to stay with my family, with my folks, and drive back and forth between my house and their house because I can't find caregivers to work for me. And I cannot access the backup services program in Sacramento County or for the amount of time that I need because I get denied and nobody's tracking it. And I'm a highly functional person with a disability, and most people could not endure the amount of calls to these backup services providers or being denied access to the agency contracted provider for Sacramento County that I've had to endure. It's not right to leave us in our homes without care. The state has a responsibility to ensure that. So I'm raising this because these issues of people with paramedical services or need and/or protective supervision or who have chronic care, complex chronic care conditions are falling through the cracks and their conditions are worsening. We are all desperate looking for care providers and we can't find any.
Thank you, Connie. If anyone else wants to make a public comment, or I don't know if we want to move on to addressing any of that. I don't see any other hands raised at the moment.
Okay, if there are no further hands raised, Connie, thank you so much for being here and for being at the HCBS gap analysis meeting and for your advocacy and for what you left in the Q&A that will become a permanent record of this meeting. Thank you for being here today. At this point, we will, if anybody has closing thoughts, we didn't respond to everything, but let me assure you, we heard you. And so we will take back what was just shared by Andy, Nancy, the committee members, Kevin, absolutely. On the substance side, the process side, we continue to work with the other stakeholder committees. And so parts of this will show up in those meetings. The other 6 stakeholder meetings that are kind of a spinoff of the master plan for aging, and those resume. They start off the year next week with our next series. The Aging and Disability Equity Advisory Committee has already met for the year for the first time, as has the California Aging and Disability Research Partnership have held their meetings. We look forward to the Disability, Aging, and Community Living Advisory Committee, the Elder and Disability Justice Coordinating Council, and the Alzheimer's Disease and Related Disorders Advisory Committee meetings coming up in the next few weeks. So if at any point you have questions about any of this and you want to work one-on-one offline with us on the process for the master plan, as you dig deeper into the initiatives, if you have questions about any of them or they're not, you don't understand what they mean, feel free to reach out to us. I think on the next slide, maybe we have how to do that. You can always contact us at engage@aging.ca.gov with questions, comments, suggestions. We welcome emails and letters from individuals and organizations to lift up important topics to you. And we know we're just about to start the legislative session, and we fully expect with a new legislature, and I think it's 37 new members, we expect to see a number of introduced bills on all of the topics of the 5 bold goal areas. So we'll be working with the legislature on those, and we look forward to that. I want to thank you all for joining today, for your comments, for being so well prepared, for taking the time over the last 4 days to review all of the dense and extensive materials that we just released on Friday. This is the start of the conversation, the start of the year, the start of the budget season, the start of the legislative session. So I think we're in a good place to begin the year and keep the conversation going. And we welcome continued questions, feedback, and input from all of you, whether you're an impact committee member or not. We want to hear from you. And with that, if I don't see any questions in the queue, any closing thoughts from impact committee members with a few minutes to spare? All right, I'll just close by,
Just thank you for all your work, and thanks to other impact committee members too.
And thank you to Darcy Delgado, who's representing Secretary Galley on today's meeting, and for Kim McCoy-Wade, who's representing the governor. And impact members had an opportunity to talk with Secretary Galley earlier. And, 3 things he said is he shares your urgency, we're leaning in, and the priorities of the impact committee are in full alignment with where we're headed in this administration. So thanks for your great work, and enjoy the rest of your day.
Thank you. Excellent.
Thank you.